Firstly, you log into the Smilefast website, www.smilefast.com.au, and then you will log in with your special username and password that has been given to you previously. So once you've logged in, you want to create a case. And there are different types of cases that you can create. You can either create a treatment assessment where we provide you with a yes or no whether this patient is acceptable to Smilefast. You could create a pure digital setup case where all that you will receive is a digital setup to show your patient, and then later, if you need to, you can upgrade that to the indirect bonding procedure. Or you can select a one arch indirect bonding if you want to do either the upper or the lower arch, or you can select upper and lower indirect bonding if that's the way you wish to proceed. Once you've selected the case type, you have to fill in the patient details, their name, their date of birth, their sex, etc., as you see on the screen. Then you need to fill out the section on the patient chief concerns, being whether they want the front teeth straight, the upper teeth straight, the lower teeth straight, whether they want the teeth moved backwards, forwards, etc., as seen on the portal. Then you need to load the patient photographs, and there is a mandatory set of 8 photographs that need to be loaded, which are the 3 facials and the 5 intraoral shots. Below that, there is a section for other images that need to be loaded, or you have the option to load these other images if you so desire, such as half-open photos or a centric relation photograph if the patient is a class 3 and has a functional shift. You will see an option on the top left-hand side in the treatment area which says impression. You have the option of a physical impression or a digital impression. If you have a digital impression, you can download the STL files directly into the portal. If you have a physical impression such as a PVS, then you would click on the PVS impression and we will show you what you need to do. And then underneath that, you have the treatment details where you need to select which arch you're going to treat. You need to select the bracket system, whether you use ceramic brackets or composite brackets, but we recommend ceramic brackets in all of our cases now. The arch form that you wish to utilise, which by default will give you the normal arch form, and the bracket height, whether you want a normal bite setup or whether you want an open bite setup, so the brackets are positioned more gingival than normally, or whether you need a deep bite setup where the brackets are positioned more incisal than normal. In other words, trying to reduce the deep overbite. You also have the option of informing them of how you want the bite addressed. In other words, would you like the open bite closed by extrusion of the upper incisors or extrusion of the lower incisors, or by a combination of both? Or if it's a deep bite situation, do you want intrusion of the upper or intrusion of the lower anterior teeth, or once again a combination of both? And you can provide the technicians with an idea as to the ideal finished overbite that you would like to achieve for this particular patient. You also have a section there which talks about the tooth movements. This is where you would select, if you were doing lower incisor extraction, you would click on that particular tooth and it will give you options of whether you wanted to extract that tooth, or you may want to over-rotate a particular tooth, or you may not want a particular tooth to be moved at all because it's part of a bridge or an implant. And this is where you can click on the relevant box for that. You will see a section which says IPR. This section only needs to be filled out for those cases that require significant IPR by yourself. For example, a central incisor which may be very wide and you know that you're going to be doing 0.5 millimetre of IPR on the mesial and distal surface of the tooth. For normal IPR treatment, you'll be running a blue strip or a yellow strip through the contact points. There is no need to fill in this section. If you are going straight to the indirect bonding process, it will discuss tray fabrication. Do you want the trays to be in one section or in 2 sections? Once you've filled out all the areas in our portal for that particular patient, such as the patient details, loaded the patient's photos and all their images, filled out the treatment requirements. Then you click at the bottom of the screen, save and submit, and this case will then be directed to us. If you have taken a PVS or physical impression, you then go back into the patient's chart on the edited open screen, and there'll be a docket there which says lab docket. You need to print that lab docket and place that with your PVS impression and send it to the lab which is listed on that lab docket. Now you've completed all that you need to for the process, and we will start the fabrication of the digital setup.